The inside story on the issues that affect you and your community. This is Local 12 Newsmakers.
Good morning and welcome to Local 12 Newsmakers. I'm Dan Hurley. Several months ago, Governor John Kasich floated the proposal that Ohio convert some of its state universities into charter universities, which are sometimes referred to as enterprise or entrepreneurial universities. The basic idea is that universities would be freed from some of the oversight of the state of Ohio in areas such as the level of reporting required, regulations around construction, financing, personnel matters, purchasing. In exchange, they would receive less financial support from the state of Ohio, something that looks good to legislators trying to close an $8 billion budget gap. Both University of Cincinnati President Gregory Williams and Miami University President David Hodge have welcomed the discussion, but have pointed out that no concrete plan has yet been laid on the table. That is the responsibility of the Chancellor of Higher Education, Jim Petro. On Thursday, the UC chapter of the American Association of University Professors invited Gary Rhoades, the General Secretary of the AAUP, to speak at a session entitled Charter Universities at What Cost to Whose Benefit. I did not want to miss the opportunity to invite Gary on Newsmakers. Rhoades is a professor of higher education at the University of Arizona, where he also directs the university's Center for the Study of Higher Education. His research focuses on restructuring of academic institutions and the professions in the academy and technology issues in higher education. I attempted to get the administration's perspective today as well, but Jim Petro was unavailable. Bruce Johnson, the head of the Inter-University Council of Ohio, who has spoken in favor of the idea, declined because no specific proposal has been presented, as did an administrator at the University of Cincinnati. Welcome to Cincinnati. Welcome to Newsmakers. You're literally right off the plane.
I'm delighted to be here. Thank you.
Okay. Let's begin. What's being proposed in Ohio is not unique. This, with variations, is being explored, tested, attempted, proposed in lots of other places. Is that right?
That's exactly right. It also is not new. It's basically formalizing a pattern that has been in place for 20 or 30 years of diversifying revenues in higher education. So the idea, for example, of an entrepreneurial university is 30 years old. And many universities have been following an entrepreneurial path, which is precisely why we find ourselves with such high student debt, and part of why we find ourselves in confronting a range of problems today.
What does that mean? What over those 20 plus years, what has entrepreneurial university meant?
It's meant that universities have begun to behave more like enterprises and become entrepreneurial in trying to generate more of their own revenues. And they have begun to act more independently rather than working within a system in the interests of the state. They've begun to act more like firms. And firms seek to maximize their revenues and maximize their prestige. And so that is part of the shift of the burden of the cost of higher education, a dramatic shift to students and their families.
There's the increasing tuition, and anybody who's had children who's just are heading for college or
Exactly.
have recently emerged from college know all about that. There's also been efforts in state universities, which traditionally never had a significant endowment,
Right.
to develop endowments.
Exactly.
For state universities to create licensing programs to move things from
technology transfer.
from
yes.
technology out into the market.
Yes.
All of those things are part of what you're talking about.
Exactly. In fact, I wrote a book with Sheila Slaughter about 6 years ago called Academic Capitalism and the New Economy. It's about entrepreneurial universities. There was a book 7 years before that entitled Academic Capitalism, Entrepreneurial Universities. Derek Bach wrote a book about corporatization in higher education that was about enterprise universities. So this is a long-standing pattern. What these current proposals do is to formalize that pattern in a sort of bargain, which I would characterize as a Faustian bargain, because what the institutions are calling for is deregulation on some matters, but actually greater regulation on other matters.
So what do they want? I tried to summarize from what I can understand, but what are the areas, concrete examples of what universities would really like liberty and deregulation in?
Well, think about the terminology that gets used with regard to tuition. So in this state, and also in other states, the language is about tuition relief for the institutions, which means there's deregulation in that they can charge levels of tuition that they want, they can differentiate tuition, and they keep the tuition monies, which does make sense. What that means for the consumer, for the students, is higher and higher and higher tuition. And Virginia's the most long-standing example of a system that has formalized this relationship that apparently Ohio is beginning to consider. And tuition in that state has accelerated at such a level since 2005. It was already relatively high, that the state legislature has come back and introduced in 2007, 2008 incentives to encourage institutions not to raise their tuition as high as they have been raising it. So one of the concrete direct effects and direct costs of charter universities is that students will be paying considerably more for their education.
Now, in the case of Virginia, I do have personal experience long ago, 35 years ago. I did my graduate work at William & Mary, but William & Mary, University of Virginia, Virginia Tech, these are not typical state universities,
no, they're not.
especially the first two.
Right.
They don't look anything like Ohio state universities. They're small,
Right.
They have a very long tradition of privatization before they became state universities. They were expensive, they were exclusive. So is there something there that Virginia is just operating in a different field?
Virginia and Ohio both actually confront similar problems, even though they're in a different field, as you say. They're operating in a different field. The basic problem that they face, and here's the opportunity cost of enterprise universities, is in both states there's a need to educate a far larger proportion of the state's population to a college degree. Previous administrations in Ohio have identified at the Board of Regents and at the gubernatorial level the need, like the nation, for Ohio to build a knowledge-based economy. Enterprise universities do not solve that problem. In fact, they are counterproductive to educating more Ohioans, because what the enterprise university is incentivized to do is to chase out-of-state students who will pay more tuition. And so that deregulation of not just what the tuition level is, but of who your students are and where they come from is actually counterproductive to one of the chief problems that both Virginia and Ohio, and in fact the country, face.
Looking at globally though, if Ohio universities then attracted some of the best and brightest from other places to local institutions, raising the possibility that they then stay here, is the net gain in the long run better for Ohio?
That's a nice goal, but the reality of a variety of studies done by various scholars is that many Midwestern states, Ohio included, do not realize that net gain precisely because of their economies. People go to graduate school in Illinois, they go to graduate school in Ohio, and they leave the state for the high-tech economies of the coasts and of a variety of large metropolitan areas. So that's not really a great strategy. It's more important to grow your own. And when you grow your own, it's important to provide opportunity for most of the universities, not just the elite universities, to do that work of educating the first generation students.
You know, the Virginia increase in tuition that you mentioned, as I looked at it and trying to do some research, how much of that, I mean, there's been a very sharp in the past year. How much of that, though, was an incredible increase, 23, almost 24% at one institution? Does that throw the whole thing off?
No, if you look at those two other institutions that are really part of the top tier of the charter universities in Virginia, the University of Virginia and William & Mary, this year the increase at the University of Virginia is 9.8%, and they're very proud of the fact that they've kept it just under 10%. At William & Mary it's 7.5%. But then they also have differential tuition for students who are going into the business school, for students who are going into law school, or students who are going into different majors. So the increases are high across the board, and there is a growing gap between household income in the state, the level of household income, and the tuition increases.
How does all of this, in your mind, relate to what we call here in Ohio, and you of course are looking at this from a national perspective, of Senate Bill 5, which has been passed, is now law, but it may end up being on the ballot again in November for a repeal.
Right.
But how does this relate to Senate Bill 5?
It's quite possible, although because there aren't any specific plans laid out yet, that's not entirely clear. But given that one of the areas of deregulation is human resource management in dealing with personnel, it's quite possible, and that's also true in Virginia, it's quite possible that this charter idea is very much like SB 5. It is certainly like SB 5 in what it does in the area of construction. So it enables institutions to construct facilities and not pay the prevailing wage, although I know in the latest iteration they can choose to pay the prevailing wage.
But they don't have to.
But they don't have to. So that raises the question for Ohioans, is this the path to a strong economy, to pay construction workers less?
So this is another way of going after organized labor.
Yes.
Now you head the AAUP, which is organized labor in an academic environment. Is your opposition simply self-interested? And I raise on the other side of that, the Cincinnati Business Courier every year publishes the 50 top paid public officials in our region. Of that group over the last several years, 49 of 50 have all been from local state universities, University of Cincinnati, Miami, or Northern Kentucky University.
Right.
The only person, he makes it about number 48, is the city manager of Cincinnati. So, you know, it's not like university professors are poorly paid here.
Actually, the pay of university professors nationally has been far lower than what most people believe, basically at about the cost of living increase every year. The pay of academic administrators, however, has increased considerably more than that, not just in Ohio, but nationally. And certainly the pay of presidents. The Chronicle of Higher Education, about 10 years ago, started a $500,000 club analysis of how many presidents were paid at that level. And that club has grown considerably. But the real problem is, with charter universities or entrepreneurial universities, the money doesn't go to the students. They pay more, but what they end up paying for is a variety of facilities, leisure facilities and the like that get invested in to attract more higher paying students. And at the same time, the classrooms sort of fall into disrepair. There's not so much investment in the faculties and in the professionals who are teaching and advising these students. And so that's another sort of opportunity cost. There's so much emphasis on building facilities, but not emphasis on building the human capacity of the colleges and universities to provide a quality education to their students.
I'm just about out of time. Last question here. This plan has not been clarified yet, and that's one of the reasons I couldn't get anybody else on here. But it is sort of in the budget, as I understand the budget, which is complicated in itself. What would you advise, and what are you advising people, especially AAUP members in Ohio, to do?
To take heed, because although this particular plan is not clear, the frame of the plan and the effects of the plan, state after state after state, are actually quite clear. You can guarantee that students will be paying more. There will be more focus on building facilities, not on investing in people to work with those students. There will be more individual sort of competition among the institutions rather than cooperation to serve the students and make it easier for them to transfer from one place to another. So the costs are actually quite clear, even though the particular details of your plan are not.
Thank you very much for being here this morning. I've had a lot of viewers ask me to get at this topic, and this is the first time we've had a chance. So I really appreciate it. Thank you for coming to Cincinnati.
My pleasure.
Stay tuned after the break. One of the impacts of the Great Recession and the continued joblessness, a shift in the profile of people needing assistance. Welcome back. Although the Great Recession is technically over, its enduring impact continues in the form of foreclosures and long-term joblessness. The implications of the large economic and social dislocations of this shift can be seen in many ways, including an observable shift in the people who are asking for assistance from local support agencies. To discuss these trends, I am joined this morning by two people. Liz Carter is the Executive Director of the Society of St. Vincent de Paul in Cincinnati, and Amy Sutter is the the Director of Case Management for the Welcome House in Covington, Kentucky. Welcome to both of you. Liz, welcome back.
Thank you.
And Amy, Welcome House is an organization that reaches out to people who are homeless and people who are threatened with homelessness. Is that right?
That is correct. And we serve the northern Kentucky area, but we also serve some clients from Cincinnati, especially if they're referred by a partnering agency.
Okay, so let me ask just a very broad question. Liz, let's start with you. We know that you have, that's why I've got you on, but what kind of shift have you seen over the last, say, 3 years in the people who are requesting aid?
Well, you know, St. Vincent de Paul, because we work so extensively in neighborhoods all over the community, we've always known and found that poverty really can happen anywhere in the community. What we're seeing now, though, is that there's a tremendous growth in the folks that are coming for help from out in suburban neighborhoods where, quite frankly, people really don't think about there being tremendous need. I think it's really difficult for the community to respond to those needs because they're completely unprepared to have people who are so desperately struggling. And it's also very difficult for the people who are coming for help because they feel very much like they're the only one that needs help, that they are all alone with their problems. Yeah. Yes, yes.
And what about at Welcome House? Amy, are you seeing similar patterns?
We have seen some similar trends, and in particular, one example jumps out on my mind, and that is we had a young professional and his family who came, and much like Liz said, they were somewhat embarrassed, I think, because they had donated to us the year before. And he came, but after we were closed, and fortunately we had someone there and we were able to talk with him, and he was looking at a foreclosure. He had lost his job. He had a master's degree. His wife had taken a part-time job getting minimum wage. He had taken a part-time job getting minimum wage, but they were trying to figure out, what do we pay? Do we pay the house payment? Do we pay the utilities? Do we buy food for our kids, because they had 2 young children? So we were seeing things like that. Now, because we can work with people who are at risk, we were able to help him negotiate through that and get him connected with some other organizations that can help him with that foreclosure. But we have definitely seen a shift in the population that we serve.
Liz, how about somebody who's actually been a donor or a volunteer? Have you seen that sort of shift?
We've absolutely seen that. There's one lady that comes to mind in particular that we actually asked her if she would be willing to speak about her problem, and she wouldn't, because she was, her son came down and volunteered with us. She would give at Christmas time and give presents. And once again, it's that embarrassment of, my son's going to have to go to school tomorrow, and we don't want people to know that we're struggling. So I think at this point, in spite of studies and what the local agencies are saying, it still is sort of a hidden problem.
Yeah, and despite numbers,
yes.
And the assumption is that it's all Center City issues. Right. And in fact, one of the things that St. Vincent de Paul operates, and there is a parallel organization in northern Kentucky, is a charitable pharmacy. And I have some statistics that you put out about service in the charitable pharmacy that we can take a look at here. Since 2006, I guess, when it opened, 70,000 prescriptions worth $7 million have been distributed. since 2009, half have been to the suburbs, which just on surface, I think that would surprise most people. And a place like Anderson Township, 194 prescriptions. White Oak on the west side, 302 prescriptions. I mean, I just think that is very surprising data in my mind.
It is, and it's surprising for us too in some ways that it's so prevalent. But that's what we're finding across the board. Charitable pharmacy, people who are about to become homeless. And I think just to piggyback on what was said, a lot of times we're talking about people who are underemployed. So when we see that unemployment rate going down, it doesn't mean those families are all right. We have somebody that we worked with that was a steel worker, lost his job, went 2 years without finding one. He just took a job at $9 an hour. That family's not going to be okay. They're coming off the unemployment list. It's going to make it look like things are better, but they're not where they need to be.
Mm-hmm.
Agreed. We just did a recent research into the Northern Kentucky area, and to live in a 2-bedroom apartment, so a parents and their 2 children, or a single parent and their 2 or 3 children, the average cost of that apartment is about $725 a month, which means that if I'm making minimum wage, which is basically what this family was going to be making, they have to work 77 hours a week. Mm-hmm. And the likelihood that an employer is going to give them 77 hours a week, or that they could do that, is somewhere between slim and none. And I think one of the reasons the prescriptions are going up is because employers are employing people at 30 hours a week because it's affordable for them, because they don't have to provide health care. So I have a job, but I can't afford the prescriptions that my family needs because I don't have health care. I think that's one of the things that we're seeing also.
In your field, are you hearing this from other agencies as well? I want to be sure I'm not just picking a couple of agencies that somehow are out of the ordinary. Do you hear it with other professionals? Are you hearing the same?
Absolutely. We are very much a collaborative agency because Northern Kentucky is small, so we will work with a number of other agencies, in particular the pharmacy that you talked to. We work with them hand in hand, and we're also part of United Way, so we work a lot with the United Way organizations, and we're all seeing a similar trend.
I would agree with that, and it's it's not just the suburbs of Cincinnati. It's spread all the way out into Claremont County, Butler County, Warren County. It's across the board, and I think everybody's feeling it, and everybody's struggling to respond to those unique needs.
What has this meant for your agencies? How have you changed, not only in terms of the size of the response, but if you're getting different types of people, how have you tried to adjust with your volunteers or with your staff? What sorts of things have you done to make sure that you're providing the right services in the right way to people?
Well, I think a lot of times it starts with a person's mental and emotional ability to deal with a new problem for them. So one of the things we've done is trained our volunteers and our staff on how to talk people through, what do you tell your kids when all of a sudden they can't have the things that they used to have? Should you talk to them? Should you not talk to them? What would you do as far as being able to go in and sort of take your retirement? How would that work for you? So it's sort of issues that in the past, when you're dealing with people who have never had anything, they don't really deal with those issues. So I think there's a difference in the way we've trained people to go out and approach the folks that are coming to us.
How about you, Amy?
I think that training is definitely critical when you're talking about volunteers, and we are fortunate to have a number of volunteers that are excellent, as well as our staff. But we've also made a shift in recognizing what people need. Affordable housing is a big issue in I think across the country, but definitely in Northern Kentucky, which is what I'm most familiar with. So we have looked at how do you create affordable housing, and how do you network with landlords and things to be able to do that. And the other shift that we made is we have a food pantry, or we had a food pantry, but what we realized is that didn't meet the needs of our clients, that they have food stamps or they can qualify for those types of services. So we needed to look at what were the other needs that you're not having met. And one of the interesting things about food stamps is it doesn't cover cleaning products, hygiene products, diapers, baby food, those types of things. And so we've made a shift in what we have donated, and we work with our donor base to be able to change that in order to be able to supply those things that folks cannot get with food stamps, so that they can maintain their home and maintain their environment so that their kids have a safe place to live. That was a big change.
And I think too, as the economy has just continued to be so poor, we've seen a change in what people come and need. So 2009, people might come and say, I've been unemployed for 2 months and I'm having trouble paying this month's rent. And that's all they needed. Now they come to us and the utilities are turned off. I can't pay my rent. I don't have enough food. My health insurance is stopped. The needs are really deep and really intense. So for us, what we used to be able to spread out among a large population and be able to make a difference, we now have to focus that maybe on a fewer people in order to get them back on track.
I want to thank both of you for being here this morning. This is really enlightening about another dynamic of what we all know is out there. Thank you. Thank you for making Newsmakers a part of your Sunday morning. Join us again next week when I'll be joined for a special Memorial Day show with 2 surgeons who have worked in Iraq and Afghanistan to talk about their work. Have a good week.